Understanding ovarian cancer. 9 vital early warning signs you shouldn't overlook. Ovarian cancer is a formidable adversary in the world of women's health, ranking as the 5th leading cause of cancer-related death among women, according to the American Cancer Society. However, the silver lining is that ovarian cancer can be treated successfully if detected early. The challenge lies in the fact that the symptoms of this cancer can be quite elusive during its initial stages, often masquerading as other benign reproductive conditions or appearing as mild discomfort. In this comprehensive exploration, we will delve into the 9 early warning signs of ovarian cancer that you should never ignore. These subtle yet crucial signs include sudden weight loss, pelvic discomfort, frequent urination, irregular menstrual cycles, painful intercourse, fatigue, changes in bowel habits, bloating, and feeling full quicker. Understanding ovarian cancer. Ovarian cancer takes root when abnormal or mutated cells in the ovaries experience rapid growth. These cancerous cells eventually overrun healthy cells, disrupting essential ovarian functions, such as the release of hormones and egg cell production. In the later stages, these rogue ovarian cancer cells can spread to the lymph nodes and other vital organs, turning the condition into a severe and potentially life-threatening one. The challenge of identifying early symptoms. Women often face a significant challenge when it comes to identifying the symptoms of ovarian cancer. This is because these symptoms frequently resemble those of other common conditions. For example, symptoms like bloating, fatigue, and pelvic pain can coincide with the menstrual cycle. Similarly, these indicators are also associated with perimenopause and menopause. However, it's crucial to note that the risk of ovarian cancer increases with age, leading some women to dismiss these signs as normal aspects of their transition into a different life stage. 9 early signs of ovarian cancer. Detecting ovarian cancer demands a vigilant eye for early warning signs that should prompt you to seek medical attention. Regardless of how mild or commonplace these symptoms may seem, especially if they align with those typical during the menstrual cycle, it is imperative not to overlook them. Here are the 9 critical symptoms of ovarian cancer that you should be aware of. Fatigue. Ovarian cancer can impact blood circulation, leading to persistent fatigue. Additionally, the body often conserves energy in response to tissue damage. While fatigue alone may appear broad as a symptom, when combined with other signs, it raises the suspicion of ovarian cancer. Bloating. Ovaries play a significant role in releasing and regulating estrogen and progesterone. Any disruption in their production due to ovarian cancer can cause the gastrointestinal tract to fill with air, resulting in persistent bloating. Pelvic discomfort. Given that the ovaries are located in the pelvic region, it is not surprising to experience discomfort and pain in the lower back as ovarian cancer develops. This discomfort is linked to the expansion of malignant cells and the destruction of healthy ovarian tissue. Frequent urination. The proximity of the urinary bladder to the ovaries means that ovarian cancer can also influence bladder function. Consequently, women with ovarian cancer often experience frequent urges to urinate. Feeling full quicker. Early satiety, a condition where you feel full after consuming only a few bites, can be associated with ovarian cancer. This sensation arises from the presence of a pelvic mass that directly affects the gastrointestinal tract, causing premature fullness. Painful intercourse. The development of ovarian cancer can make sexual intercourse painful. This discomfort may radiate from the pelvis or inside the vagina, and can be attributed to the growth of cancer cells, leading to hormonal imbalances resulting in dryness during intercourse. Sudden weight loss. Women with ovarian cancer often experience weight loss due to the premature feeling of fullness, which curtails their food intake. Additionally, the body's efforts to repair tissue damage in the ovaries can lead to changes in crucial functions, further influencing weight loss. Changes in bowel habits. Ovarian cancer's impact on the gastrointestinal tract can manifest as changes in bowel habits. This may include symptoms like constipation or irritable bowel syndrome, stemming from abnormal ovarian function affecting various hormones. Irregular menstrual cycle. As ovarian cancer invades the ovaries, it disrupts the organ's critical functions, including the menstrual cycle. Therefore, If you typically have a regular menstrual cycle and suddenly notice irregularities, it is essential to consult your doctor promptly. How is ovarian cancer diagnosed? The initial step in assessing ovarian cancer is a pelvic exam performed by your gynecologist. This straightforward procedure involves a physical examination of the ovaries to detect any enlargement. Alongside the pelvic exam, a transvaginal ultrasound is often employed to provide a more detailed view of the ovaries, making it easier to locate any abnormal masses. Furthermore, a blood test known as the Ca-125 test is typically requested. This test measures the levels of cancer antigen 125 Ca-125, a protein that serves as a tumor marker for ovarian cancer. Elevated Ca-125 levels suggest the presence of malignant cells in the ovaries. Beyond diagnosis, the Ca-125 blood test is valuable for monitoring treatment progress. A decline in Ca-125 levels indicates that the treatment is effective. Ovarian cancer versus ovarian cysts. Ovarian tumors are a hallmark of cancer, as they signify abnormal tissue growth within the ovary. However, it's important to note that not all ovarian tumors are automatically identified as ovarian cancer. Ovarian cysts, which are benign or non-cancerous, are also prevalent among many women. While both types of growths may exhibit similar symptoms, the key distinguishing factor is malignancy. Cancerous tumors are classified as ovarian cancer, while ovarian cysts are typically benign and not life-threatening. A blood test can be an effective means of distinguishing between ovarian cancer and ovarian cysts. How are ovarian cysts formed? The pair of ovaries typically alternate in producing egg cells or ova, each about the size of almonds, and located within the pelvis. Following the menstrual period, the ovary nurtures the egg cell within a Sacher follicle. During ovulation, the matured egg cell is released from the follicle. Afterward, the empty follicle in the ovary should naturally dissolve. However, sometimes the follicle fails to disintegrate and remains in the ovary, accumulating fluid or air, thereby forming a cyst. In most cases, ovarian cysts are non-cancerous and can be treated non-invasively when detected early. How is ovarian cancer developed? Ovarian cancer originates from mutated cells within the ovary, typically not from the follicles themselves, but from the ovarian tissues. It results from DNA mutations that impede abnormal cells from undergoing apoptosis, the natural process of cell self-destruction, when irregularities or malfunctions are detected. Unlike healthy cells, cancer cells defy this process and proliferate uncontrollably, ultimately leading to the destruction of the organ and surrounding tissues. Detecting ovarian cancer can be challenging, especially when its early warning signs are often mistaken for other benign conditions. However, in light of the increasing prevalence of cancer, it is essential not to ignore these symptoms. If you experience any of the aforementioned conditions, do not hesitate to consult your gynecologist. Even a routine checkup can serve as the gateway to early ovarian cancer diagnosis. Your health should never be taken for granted, and vigilance is your greatest ally in the fight against this formidable disease.
Thank you for tuning in to Health Beat Now, where we empower you to live your best life. Remember, your health is your most valuable asset, and together, we'll unlock the secrets to optimal well-being. Stay tuned for our next episode, because at Health Beat Now, the pursuit of well-being never stops.